Hello, everyone. My name is Gurjat Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. I'm so pleased to welcome everyone to the third and final day of Lymphoma Canada's National Patient and Caregiver Conference. Our first session of the day is a panel discussion titled Life Beyond Lymphoma, Survivorship Stories. We have a lovely facilitator here with us today, Sabina, who will be prompting questions to our panelists and leading today's conversation on the ways lymphoma can impact your life after treatment. Sabina has been a longtime supporter of Lymphoma Canada and currently is a vice chair of Lymphoma Canada's board, as well as the co-founder of the Vora Miller Foundation. Thank you everyone for joining us, and I'll pass the presentation over to Sabina now so you can introduce the panelists.
Hi everyone, good afternoon, and thank you for being here today. Survivorship is the key component of the cancer care continuum. It is the link between treatment and recovery and the relationship between the patient, the cancer agency, and their primary care team. Survivorship is a unique and ongoing experience which is different for each person and those close to them. In this session, a panel of experts will discuss the ways in which lymphoma can impact a person's life after treatment. We have today with us perspectives from a patient, a physician, a nurse, and a social worker, and we hope to work through questions that relate to the changes patients and family members experience after they're in remission. So I'm going to start with some introductions so we know who's on our esteemed panel today. First, we have Dr. Carrie Savage. Dr. Carrie Savage is a professor of medicine at the University of British Columbia and has been a medical oncologist and clinical scientist at BC Cancer with a lymphoma tumor group since 2003. She obtained her medical degree at the University of British Columbia in 1996 and received a Master's of Science in Epidemiology at the Harvard School of Public Health in 2004. She's the chair of this year's patient conference and also sits on the scientific advisory board for Lymphoma Canada. So great to have you here, Dr. Savage. Then we have a nurse, Courtney Buller. Courtney Buller graduated from the University of Northern British Columbia's Family Nurse Practitioner Program in 2018. She began practice at BC Cancer in Vancouver the same year. She worked with the lung cancer group for 1 year before transitioning her practice to lymphoma, where she remains today. Courtney's experiences in oncology have cultivated her passion for providing patient-centered cancer care. Great to have you here, Courtney. Next, we have our social worker, Zeba Taibi. Zeba Taibi is a registered social worker who currently works at Gildas Toronto as a membership engagement coordinator. Within the last 10 years, Zeba has worked in a variety of roles with individuals, families, and communities. Zeba is passionate about finding ways to support and advocate for people to access services for positive well-being and quality of life within the healthcare system and beyond. Outside of Gildas Toronto, Zeba is a member of different communities focused on highlighting patient voices within the cancer system and uses her experience to contribute to cancer research. And last but not least, we have our patient, Harjeet Kaur. In August of 2019, at the age of 32, Harjeet was diagnosed with stage 4 subcutaneous panniculitis T-cell lymphoma, which is an aggressive type of blood cancer with only 150 cases reported worldwide, complicated with hemophagocytic lymphohistiocytosis. The diagnosis took almost 3 months, involving endless blood tests, scans, and biopsies. She received a stem cell transplant in April 2020 during the height of the COVID-19 pandemic. Much of her cancer experience was marked by delays in receiving a diagnosis, delays in getting tests and scans, delays in being taken seriously, and delays during the COVID pandemic. Harjeet is an incredible advocate for cancer patients and has a fantastic blog titled My Cancer Battle, My Journey. I encourage all of you to visit her blog and read more about her journey. It's really nice to have you, Zeba, as well as Harjeet on our panel today as well. So topics in this session will highlight 4 themes. It's going to be emotional, physical, social, and financial aspects of life, including nutrition, exercise, relationships, as well as talking to others about what survivorship means. And so we're going to begin the session first by tackling the emotional component. And with that, my first question is going to be for you, Harjeet. Harjeet, the transition from being a cancer patient to a cancer survivor can be an emotional roller coaster. What did this transition look like for you, and what were your primary concerns following completion of treatment?
Thank you, Sabina. First of all, I mean, it wasn't easy. I mean, I never expected that I'll come out of it, especially during the COVID when I had to go for stem cell transplant and I had to stay at Tom Baker Cancer Center for 35 days, fighting for this battle all by myself without having a family or friends or husband, anyone close by. Those 35 days were really challenging, and I never thought that I would fight that battle and be here after 3 years talking to you guys. The survivorship battle has not been easy for me, but that's one thing which has always given me that strength is the hope of getting better every day, hope of living my life in the present moments, and thinking and grateful that not everyone gets the second chance. And I was the one who got this second chance in life. And my donor was my brother, who was my 100% match. So obviously, not everyone gets that chance of, 100% donor match or everyone who comes out of stage 4 cancer so easily. But I mean, the struggle was real and I am here. It's been 3 years. So currently I'm like 3 years old baby after stem cells. So I still have those kindergarten cells, but I'm actually fighting every day with that battle still, mentally, physically, socially. But yeah, I'm proud of myself that I'm here to talk about it and spread awareness among young adults who are dealing with cancer. And it's important to advocate for your own health when it comes to, at this young age, when people go through cancer, it's not easy for them to have that battle, fight that battle. For me, being an immigrant, because I moved in 2018 to Canada and 2019, I was diagnosed. So I didn't had that, chance of, you know, it was completely a life-changing thing for me. My life completely flipped upside down in a new country. So yeah, but I'm here. I'm grateful that I'm here. It's been 3 years, many more years to go. I still go for my blood work and scans annually, but yeah.
Thank you so much for sharing your journey with us, your experiences with us as well. I have a follow-up question for you, and it's a question that we've actually received in our panels. I've been doing these survivorship and panels with Lymphoma Canada now going on 6 years. And one of the questions that we receive very often, in fact, is in terms of life after cancer, many patients experience that fear of recurrence. Could you perhaps share with us some coping strategies that you may have used, or some that you've integrated into your life to navigate around some of this?
So one thing is obviously reoccurrence. Every patient goes through that phase. There's always a chance of reoccurrence, but sometimes people, who love you and who care for you, they always tell, right? That, just move on, go ahead, don't think about it much. But it's not easy for a patient to just move on. So in my case, being through a South Asian community, it was really difficult for me to move on. But I started writing my blog. The first thing which I did was I started writing my journey out, because that was one thing which I really wanted to do for myself, for my peace of mind. And then I started talking to a psychologist and social worker in the hospital. And I really wanted to take this out because whatever I've gone through in last 2 years was not easy for me. So that strategy of, writing everything down and journaling and blogging and then talking to my social worker, talking to my psychologist and working on my health, right? I love going out in nature. So whenever I feel low, I just go for a walk or I just go to the mountains. My strength is not so much that I can go for a hike or something, but then I just go out and take a walk in the nature or work on my health, do a little bit of yoga, whatever keeps me motivated throughout the day. And that fear of reoccurrence will always be there. I mean, whether it's 10 years or 5 years down the journey, you'll have this fear in your mind, but it's just how you keep your mind busy with different things and talk about it if you're feeling that there is, something which is going on, but you need to talk, you need to share it with someone.
I have to say, I did read all of your blog posts and you write beautifully. So thank you for sharing that with all of us. And again, I encourage everyone to go check out your blog. It's written so beautifully and so fantastic. So thank you for sharing that. One of the things you mentioned was how impactful your relationship with your social worker is. And so I'm going to switch gears now and Zeba, go to you and, just ask you, do you find there are, any differences in the way patients cope with challenges post-treatment depending on their age? Because again, we know with lymphoma, there is a huge age range that plays a role as well. So could you maybe share with us some of those challenges based on age?
So I think it's important to understand that everyone's experience is different, and usually depends on the age of the person, but we find that sometimes a lot of people in their 20s and 30s and older want to engage in support groups or individual therapy to learn coping strategies. And it's helpful to have coping strategies in your toolbox in moments of stress and challenges. And the coping strategies, I find, depends on the age, right? For a lot of older folks, it may be getting out in nature and walking, things like that. For some younger people, it may be hanging out with friends or going out, right? So that may depend on the individual, but all coping strategies look different for everyone, regardless of their age.
Thank you for that. And so could you perhaps, I'm just going to ask you a follow-up and maybe expand on what are some of the emotional supports that are available to guide patients during this transition period?
Yeah, so there's a variety of different groups, and just with my role, like Gilda's Toronto, we provide psychosocial oncology support. So just in general, the psychosocial piece is very important, and that's something that lingers beyond the actual treatment itself. And so there's support groups that are offered for those entering post-treatment. And it's a place where you can talk to others that are dealing with the impact of their cancer on relationships, emotions, side effects, strategies to create a new normal. Many times, often all the time, people can't go back to the person that they were before. Right. So it's talking to people that are in a similar situation that are transitioning into post-treatment. And there are other emotional supports through mindfulness and yoga or other coping strategies to help process and regulate these emotions.
Thank you for that. Courtney, I'm going to switch to you. And we also know that oncology nurses play such an important role in the provision of some of the survivorship care. Could you perhaps tell us what you would say are some of the more common emotional challenges that patients experience once treatment ends?
Mm-hmm. Yeah, so as Zeba had mentioned, it's often that after you've been through treatment, through diagnosis and treatment, that you have gone through this physical, emotional, and often spiritual changing experience. And so returning to life as normal is often unrealistic. And in that are a lot of emotions. People feel joy and happiness once they discover that cancer is no longer there and that treatment was successful. But often there is anxiety, depression, uncertainty as you move through survivorship, and it impacts everybody differently. And so I think it's important to know that as time passes and some of the physical symptoms associated with treatment may resolve, there are still a lot of emotional things that will continue to happen. And we know that anxiety, depression, and stress impact people differently and impact people in different ways. And so I always tell patients that it's important to first acknowledge these emotions, to get validation that these are okay and normal emotions to have, and then to express them, to try to find ways that are helpful to identify what they are and to find the resources and the skills to accept them and to have, feeling of normalcy, whatever that may be looking forward. Mm-hmm.
That's amazing. Thank you so much for sharing some of those strategies as well that you use when you're speaking to some of your patients as well. what are there any other supports that you can recommend, to support a patient emotionally post-treatment so they feel most comfortable in their transition?
Yeah, I think sometimes even just being available to listen, to hear the struggles that are happening at that day, because we know that the oncology visits are often regimented, they're short, there's purpose to them. And sometimes that doesn't fit in with how you may be feeling or the uncertainty that may be happening. And so as a nurse practitioner, I try to be available to my patients when those things come up. And even just a phone call and a check-in and referrals to the great counseling and social work services so that we can access supports for people that are struggling. The other thing that I like to tell people is that it's important to remain an active participant in your health and to be very mindful if things are changing and to share that news with your oncology team immediately so that if there are things going on, they can be found and investigated and dealt with.
It's amazing. So listening, being there, and advocating for yourself are really, really critical. Dr. Savage, I'm going to move over to you and ask you this question that I think in all of my years at Lymphoma Canada has been a recurrent question. Every patient hopes for the day when they can finally breathe that sigh of relief, right? While we know that there's no one-size-fits-all timeline, but from a medical standpoint, can you give us some more information when a patient can consider themselves fully cured and what that actually means?
Yeah, you're right. And that's a really difficult question, particularly in lymphoma when there's 60 different types and there's sort of two different main categories: indolent lymphomas or CLL, where people go into long remissions, but it's not curable with standard treatments. And then on the other hand, we have aggressive lymphomas, diffuse large B-cell lymphoma, peripheral T-cell lymphoma, and Hodgkin's that are curable. So that there's that two distinctions. So one's more of a chronic problem, the other is potentially curable. And then within those curable lymphomas, they each have their own time of risk. But maybe just taking for an example, because I think maybe your question is a bit more for curative cancers, curative lymphomas. But for example, taking diffuse large B-cell lymphoma is the most common aggressive B-cell lymphoma that we see. And there's been useful studies looking at the risk of relapse at event-free time points, because the prognosis changes as you respond to the treatment and get into a remission. So we have to recalibrate. And even if you're at 1 year, that's different than end of treatment in 2 years. So for that example, there was a study from the Mayo Clinic that identified that if you get to that 2-year mark, the subsequent risk of relapse was around 5%. And so that's actually a time point where we are off, depending on resources available in the oncology clinic, that might be a shift to the family practitioner to take over the oncologic surveillance because the risk of relapse is so low. So and for Hodgkin's, it's similar. We did a similar study actually out of BC Cancer, and it really is a low risk at beyond that 2-year mark. Peripheral T-cell lymphomas are a little bit more variable and the risk is a little bit higher beyond that. But yeah, so it is a complicated question. But I will also say, some people do have transplant, as you've heard already from Harjeet. And I think that we're seeing similar data, at least for some of the lymphomas, like aggressive B-cell lymphoma, that 2-year mark seems to also be very, very important.
Yeah, and so, there's no surprise why this is such a complex and a confusing question, that our patients have very frequently as well. But thank you for taking us through it in a very quick, short timeline as well. And I have another question for you, and it's slightly different from the core medical question in terms of, curative, what is curative? But in your opinion, What are some of the issues that patients should be thinking about as they transition from being an active patient to a survivor?
Some of the things they should be thinking about, you mean, just kind of, maybe picking up on some of the other comments that have been said. And of course, it is going to be treatment dependent, lymphoma dependent, age dependent. So there's a lot of different factors. But I think, one thing that I've noticed is obviously when people are coming in for treatment, there's a lot of interaction, and it's typically every 3 to 4 weeks that they're seeing an oncologist. And then you come to that end of treatment and you're in a remission, and then we're shifting to that surveillance phase. I find some patients feel that a little bit of angst just with that. What do you mean I'm going to see you in 3 months? We've been doing every 3 weeks. But I always, try to say, well, it's a positive. It means because you're in this remission, we can stretch things out, but we always have this deal. And as Courtney also alluded to this, if anything changes between the visit, we're a phone call away. And I always say, I'm happy to see you earlier if there are concerns. So it's not, even though we're not seeing each other every 3 weeks, we are available. And I think that's really important. And then I think for me, the conversation is tailored a little bit depending on the situation, but I do try to come to that point of how you are doing beyond, after I go through the medical list of questions, because trying to tease out how they're adapting to everything they've been through and what's to come. And because there are some people that it is hard to make that transition, and younger people, I think too, trying to get back into the workforce. What can I do to support? Do you need a letter to your employer? So you have a graded entry back into work. You can't go back in where you were before. Otherwise, it's can be overwhelming for a lot of people. And you need to be a bit gentle with yourself, and that's okay. And a lot of people go through the same thing. So that check-in, what can I do? And then linking to additional supports as needed. So if I pick up that maybe there is a mood issue at that point, then I really try to encourage patient and family counseling. We have fabulous psychiatry team as well, if that's relevant. And then I'm lucky because Courtney and I work together, and she has a different time and schedule than me. And sometimes we'll like, can you check on this? Can you check on this person? And I think that's really helpful as well.
Thank you, Dr. Savage. You alluded to how care changes for patients once they're, when treatment is over. And so my next follow-up question for you is on that same note. What does a typical survivorship care plan look like for patients, and who's responsible for this care?
Yeah, that's a good question. And that changes too, depending how far we're out from treatment. But I'd say a fairly standard surveillance plan after the conclusion of chemotherapy is follow up every 3 months for the first 2 years. And that's for most indolent lymphomas, and certainly for the curative lymphomas as well. And at those visits, it's really the most powerful thing, honestly, is how people feel. That to me is the most important, which is why I also tell them to call me if you're not feeling well, because don't wait for the appointment. We can move that up. We do a physical exam. There's blood work. Other test imaging is really case by case basis. We really try to not go nuts on that, particularly with curative lymphomas, because there isn't any evidence that finding something at a different time point actually changes outcome, and there can be some disadvantages to it. Usually with the more chronic lymphomas, there might be some imaging in there as well, CT scan periodically. And then at that 2-year mark, and this is not true for all centers because everybody does manage this differently, but we don't have a specific surveillance clinic like our survivorship clinic. So we, the 2-year mark for curative lymphomas, we are frequently shifting to the family practitioner, and we send out a letter detailing what we want done. And the visits usually stretch out to every 6 months. And then at 5 years, it's annually thereafter. And then for the more indolent lymphomas, I think most of us keep the indolent lymphomas because there is that chance of it coming back in the future, and having maybe a lymphoma hat is helpful. But this is very center dependent. I think that practice might vary between different places on who's performing what role. And I can tell you, when I first started here, you heard that I've been here 20 years now. Can't believe it. That was just October 1st. When at the beginning, we used to hang on to everybody. And can you imagine, our clinics just got unruly. And now there's so much more complexity to the treatment now than even 20 in my own lifetime, that we just don't have the space or the resources. Like, this is a huge problem. We needed a new building yesterday. So I have to kind of focus on the people that need us now, and have a shared plan, and that we just have to make sure that that's a smooth transition. So I certainly don't discharge people if they don't have a family physician to pick it up. So I do keep some people because they don't have a family practitioner. That's a problem in BC and probably elsewhere. We have more nurse practitioners coming and taking on that primary care role, which is awesome. We have one that sees a lot of our BC cancer patients, and another one about to start up again. So I'll be using that avenue as well. So, but I think just having that clear communication of what that follow-up will look like, and this security that there is a solid family practitioner on the other side, nurse practitioner, I think reduces a lot of anxiety about that move. And I will also say that I asked the person's opinion too, if they're okay with this. So there's some people, this is too anxiety provoking to leave the oncology clinic, and I'll keep them because I don't want to, that's not my job. And it's the minority. And maybe it just takes a little bit longer. So I said, okay, you're not ready yet. That's okay. We can continue this. So
I think your point about making sure you have that clear communication with your clinician about what that care plan looks like is going to be so critical and important. And I live in Ontario, and it's the same over here as well. Up to 15% of the population does not have a primary care provider here as well. And I think that's going to be really important. Probably going to be, a little rocky over the next few years until hopefully we have a better healthcare system in the works to try and meet some of these gaps that you very astutely, highlighted. I'm going to switch gears a little and maybe talk a little more about the importance of relationships and supports. Maybe Zeba, I'll go to you first. Could you perhaps take us through how can loved ones best support patients in finding their new normal post-treatment?
Yeah, that's very important as people transition into post-treatment. It's also important to recognize that everyone copes with a cancer diagnosis very differently, and the experience of a caregiver and a patient varies, right? And as a caregiver or a loved one, it's important to meet the person where they're at, right? How are they feeling? What's their experience been? Find out what they need support with. Right. You can assume all you want, but unless you're talking to that person, you're not going to know what they need support with. And let them know that you are available and open to having these honest conversations with them. Sometimes as caregivers or loved ones, you don't know how to react, right? Or what to say. And that's okay to let the other person know. And also encourage them to come to you with their needs and their wants and their wishes, right? It's important as loved ones to be clear about what you can offer and your boundaries, right? We also want you to be comfortable with that. And sometimes as caregivers, you can take on much more than you can handle, which can impact your mental health and physical health, right? So it's important to sort of know your boundaries and what you can offer, right? And there's a community of support and a wealth of knowledge out there between the clinicians, nurse practitioners, other social workers, community organization. So just help the person transitioning into post-treatment to figure out what works for them.
Thank you so much, Zeba. And I know in the previous section, you talked about some of the supports that are available to patients. But could you perhaps take us through some of the supports that might be available to caregivers, as you were just mentioning how important that is as well, to ensure that we're looking at the entire family structure as well?
Yeah, for sure. There's family counseling where, you can meet with a social worker. Many hospitals have social workers where the caregiver and loved ones can get that support throughout treatment, but also post-treatment. And it's also important to have the families be part of the healthcare journey, where you can talk to the healthcare team about some fears or concerns that you have as the person transitions into post-treatment, and also talk about the recurrence of cancer, right? Having an open dialogue with each other and those around you. And that emotional support can look very different for people, whether it's the support group to talk to other families that have gone through it or individual therapy, right? But there's also support out there to try and figure out what helps you best cope with it, right? Is it writing a blog like Harjeet, exercise, music, art-based therapy? What helps families, cope with that anxiety? So it's important to sort of leverage and use those that are around you and that you're already connected with, but also some hospitals have social workers or nurse navigators that can help you try and figure out what other organizations or agencies are out there to support you in that transition.
Yeah, that's such a great idea to tap into some of the resources that patients and families have to see what else exists outside in the community. So thank you for sharing that with us. Harjeet, I'm going to move on to you and ask you, you talked a little about normalcy. Oftentimes loved ones and friends may be anxious for you to get back to, whatever this new normal is after treatment. But the meaning of normal, obviously has shifted for you, for everyone else. Mm. What was your new normal, and how did you transition into survivorship, impact the relationships that you had in your life?
Honestly, I mean, for me, the new normal is this. I mean, I have never thought about that I'll be getting my old life back. And the new normal phase has been really difficult. As Zeba mentioned, that there are a lot of communities who help you to cope with this. So when I was going through my survivorship and stuff, and I started writing my blog, but I had this gap within my family. I mean, my caregiver, my husband, was amazing. He did whatever he can, but there was a gap of communication, of talking about cancer, talking about the emotions, the experiences, the pains. Obviously, the caregivers, sometimes they don't know how to talk or how to, speak to their loved ones about cancer. So that time I realized, and I started writing my own blog. And I started connecting. So one of the nurse practitioners, when I was going through my checkups, she mentioned that because I was talking to her about what I'm going through, because when I was going through the treatment, I was hardly able to see young patients at that chemo room and stuff. So I spoke to her and she said, you should connect to YAC, Young Adult Cancer Canada group. And that was the first group I connected. And I started sharing my emotions, my experiences, and I used to get a lot of answers and questions from them. And that became my family. And similarly, then I joined Canadian Cancer Society Connections. And since then, I've been, just being part of those groups. And I feel whatever I am going through, they are going through the same thing. So it's really important, because sometimes the other person who has been taking care of you for all this time, but they might not understand what you are going through mentally and physically. They might see you physical changes and stuff, but mentally, what are you going through is very difficult. And during my last 3 years, I've been on therapy, like Zeba said, and it has really helped me. That has been my constant thing, and it has really helped me in overcoming my, these things and going back to my new normal now. And as Dr. Kerry mentioned, as a patient, whenever I go to my oncologist and I talk to him and I tell him, when will I get my normal life? I mean, when I'll be okay to get back to my normal life? He's like, this is your new normal. You have to accept it, take it, that you have to be like this. This is your new normal. So that's how I've been taking it all, by going through all those things and stuff.
I think you highlighted so beautifully the power of community that exists. And it's incredible that you build such fantastic support communities through all of your, friendships and relationships with some of these other groups where people are going through similar things as you are. So my next question for you, I am also a Punjabi South Asian woman. And so in your advocacy efforts, you often speak candidly on the stigma that exists in the South Asian community, where oftentimes no one wants to speak about cancer. And, as someone, again, in the same community, I work in public health, I've seen this as well. How do you think can this be detrimental to a patient's journey post-treatment?
From my experience, I had rough time. As you said, you're a Punjabi, I'm a Sardarni, like people who keep turban and stuff. So when I was going through my chemo, I had to shave my head, but I couldn't because my dad could not see me like that. So there was time when I had my chemos, and second chemo, my hair was so tangled and I was in pain. And my oncologist said to my husband that she needs to shave her head. You can't just allow her to keep the hair on. And I still remember my husband shaved my head in front of my dad, and my dad could not take it. And every time I used to talk to my family in India, like my grandmother, I used to cover my head and talk because they used to tell me that cover your head and talk. So that's one of the things which actually, after a year impacted me a lot. And that's how I just came out of it and I started writing, and I just posted my blog socially and globally. I just wanted people to see me like this. This is me. This is what I am right now. And I started I was not taking anything on my head. I just started posting my pictures as bald head. And I used to get a lot of messages from my family. Why are you doing that? This is not necessary. You should not post it. So all these stigma, because people first, they don't want to talk about cancer because they feel it's a bad karma or, something bad you might have done in your life. That's why you're getting it. So that's one of the things which you deal with in South Asian community. Second, they don't want you to talk about it to your extended family and friends. And so the patient is suffering in silence. The patient is actually in isolation. So that's what I felt. I mean, as I mentioned before, I had a lovely caregiver and support. My parents were there, but this was one thing which was lacking, the talk, how to talk about it and what to say and what not to say. So that's why I've been more focusing on advocating for this, because I feel there's a big taboo in our community. And I've started talking about it in Calgary, Red FM channels and radio channels. And I'm trying to do it more often so that people should come out and talk about it, and they can join these support groups in communities where you can get that help. So, yeah.
Thank you for sharing all of that with us. I have no words to say how just inspiring you are to me as another South Asian woman. So commend you for all of those efforts, and your advocacy clearly has such a huge impact. So thank you for that. Courtney, I'm going to go to you, and perhaps you could also, share with us some positive ways you work with families, not just with the patients, but could you maybe share with us different ways you've seen families and friends support their loved ones during, this journey?
Yeah. So I think it's important to know that people as a whole want to support you when there are things that are going on. And oftentimes they don't know how to do it. Sometimes the support that they're offering, it's not helpful, or it can even be counterintuitive to what treatment or what your cancer plan is. And so, after treatment is completed and patients are in remission and traveling through that survivorship journey, I often tell patients to speak up about what it is that they need. And it can be difficult to acknowledge that you need help, number one, and to ask people for it. And one of the things that I find most helpful is just even talking about practical things that need to be done on a day-to-day basis that maybe aren't as easy to do anymore because of fatigue, because of side effects, or just because of how things have changed for you. So I say, if meal prep or grocery shopping or driving or walking the dog, all of those things that need to be done, but maybe you're not feeling like doing them or struggling, those are things to offer to your family and to your loved ones to try to help it pick up a bit. The other thing is just, as families and loved ones, being there just for a check-in, for a phone conversation, just to hear how things are going that day. And if they're not okay, that's okay too. But just to be that ear on the other side of the phone, so that your person who is going through this journey feels validated. Yeah.
That's amazing. I think we're going to continue this conversation on one of our other themes on just physical challenges. And Courtney, you brought up a really good point about fatigue and physical challenges that people can suffer from. So perhaps I'll start with you and ask you, you mentioned fatigue being a common symptom for many patients post-treatment. What are some of the ways that individuals can navigate through this? Because it can be pretty life-hindering.
It can be, and it's often one of the most common side effects that we see from treatment. And, the trouble is that people sometimes will think that once treatment is complete, that their energy is going to return to normal right away and that they're going to be able to carry on. And often that's not the case. Sometimes it's a slow recovery, and there are times when people do still feel a bit fatigued despite treatment being over, despite no evidence of cancer. And so navigating through that can be challenging. I always say, it's important to try to plan ahead. If things are going to be happening or events, and trying to avoid a hectic schedule, to be kind to yourself, allow time for rest in between things so you're not becoming too exhausted. The other thing is that fatigue is often multifactorial and associated with many different things. And so even though things like dehydration, poor diet, lack of exercise, these all impact our energy levels. So it's important to be able to maintain, a healthy lifestyle as much as possible through a well-balanced diet, through exercise. And, we have evidence to show us that through treatment, beyond treatment, that exercise is really important in improving cancer-related symptoms and side effects, including energy.
Actually, speaking of physical exercise, maybe Dr. Savage, I'll ask you this question. Maybe if you could expand on that and talk us through why, it's really hard when you are fatigued to get yourself to actually undertake exercise, but perhaps you could take us through why it's beneficial, to continue to have physical exercise when it comes to staying healthy after treatment, and what can patients do to help themselves get there?
Yeah, I think Courtney's alluded to this already. There's data to support it. It improves fatigue as well as potentially quality of life, mental health. So perhaps not a direct effect on the lymphoma, but from the recovery process. So I think starting it's kind of hard. Some people are exercisers coming into it, and others, they're newbies. The ones coming in often will try to do it through the treatment, which is actually great if you're feeling up to it. Because I always tell people you are the best judge on what you can do. So there's no medical reason why you can't exercise. Just recognize that it's probably going to be at a lower level. And then that group typically is much easier able to get back into it in the survivorship period. For people who haven't exercised as much in the past or not at all, you have to bring it in gently. But my motto is something is better than nothing. I do this because I'm a jogger. And we had an atmospheric river here in Vancouver yesterday, and I went for a jog after work, after clinic. But you have to kind of schedule it in to, give yourself a little bit of accountability. But it can be just a little bit. A little bit goes a long way, and then you build on it. And generally, when you exercise, you feel better. Your well-being is better, and I think that feeds into reduced stress, better sleep, better mental health. But something is better than nothing. Just start somewhere and just be gentle with yourself and schedule it in. And I will say for younger people too, some people have families and kids where they're doing all this. And I think women in particular are trying to do it all. And you have to ask, like I think Courtney alluded to that too. People might not necessarily know exactly what you need, but just say, okay, Wednesday night is my night. I'm going to go yoga or whatever, go for a walk with this group, and you work out a schedule within your family to make that happen. So you also have to voice what your needs are, but I'm pretty sure the people around you are going to make that happen.
Amazing. Thank you so much for that. And just to continue that conversation, Zeba, perhaps I'll, pass it over to you to maybe give us some suggestions on how you can support patients struggling to incorporate physical exercise into their daily routine, perhaps, because of pain, nausea, fatigue, or other physical challenges.
Yeah, I think a few of these points were mentioned before, but it's important to listen to your body, right? You're the best judge of your body, and as a social worker at Gilda's Toronto, we offer groups, right? Sometimes it's hard to do it by yourself, so we offer groups where you are incorporating that exercise with people that are going through what you're going through. And so there's that sort of connection there as well. And I think the most important thing to realize is that, it's like Dr. Savage says, like it's better to do something than nothing, right? And you show up in whatever capacity that you can show up in, right? And it's important to listen to your body. And if you experience any symptoms that aren't feeling right, you should talk to your doctor or your nurse practitioner about that. But I think just offering some sort of group support where, there's accountability if that's something that encourages you to put on your running shoes, right? That's a huge step, just putting on your running shoes and showing up, right? So there are groups available and you can show up and participate in whatever capacity that you can. And if, people need accommodations because of physical challenges or any side effects, ask for those accommodations, right? Mm-hmm. And sometimes we talk to the facilitators that are leading those groups and advocating for accommodations as well.
Mm-hmm. I'm just going to ask you a follow-up question. We talked about some of the physical challenges, but what about some of the other, health challenges that people have? So what are your recommendations on how patients can cope with challenges that present post-treatment, such as muscle tension, indigestion, appetite issues, headaches, nausea, everything else that, that comes as a part of sometimes what survivorship can look like?
Yeah, and I'm not an expert in this area, but I often make resources and referrals for individuals that are experiencing this and seeking expert knowledge, right? For headaches or nausea or something like that, perhaps working on nutrition, and we offer nutrition courses as well from a nutritionist that works primarily from a chronic illness perspective, right? Mm-hmm. Exercise is another good option to help cope with these challenges. But also, if you're looking at other areas such as art-based therapy or emotional focused therapy, right? Sometimes mindfulness or yoga is something not as physically active can support or help with the headaches or something like that as well.
I remember from our last year's talk on this, we also had some folks that had recommended doing things like mindfulness yoga that you mentioned, massage therapy as well. That seems to also help patients as well. Thank you for sharing those tips with us. And Harjeet, perhaps I'll take the question over to you and ask you, if you would be willing to share with us what are some of the physical challenges that you personally experienced after treatment, and how did you manage those to give, our audience some more tips and suggestions as well?
So after stem cell, because it happened in COVID, so everything was shut down for almost a year. So I came across a program through Alberta Health Services, which was Wellspring. So it was doing some, I don't know if other provinces has it. So it's like a rehabilitation program for cancer patients. So I did join that, and I used to have mindful activities, yoga, meditation, and some little bit of stretching exercises, which I started with them in, I think, November 2020, because 6-7 months it took me time to get out of the bed because I was completely bedridden after stem cell. So it was not easy for me to get out of the bed. I remember my mom used to give me a shower and take care of me. But after that 6-7 months, I wanted to do something. So my doctor, my oncologist recommended me to go for like 5 minutes walk and start with that. So I started with that, but I did join those programs through Wellspring, and it really helped me. It really helped me in doing all those mindful activities, yoga, some stretching exercises. So because of COVID, everything was shut down and you were supposed to be at home. So that was the best thing. It helped me. And after that too, I mean, I've continued those programs for 2 years. So it was 2 years program. So I did that and it really helped me. And so as I mentioned before, there are a lot of support groups and these kind of helps available for cancer patient out there. It's just, you need to speak to your social worker or your oncologist or your nurse, and they will guide you to the right path.
Yeah, Wellspring is such a fantastic resource. So thank you also for bringing them up, and for that shout out towards Wellspring. We've done a lot of partnership work with them as well for that reason. So thank you for sharing those. So the last component of our panel today is switching gears and talking a little bit about financial impact and support. And Harjeet, perhaps I will start with you since you have your mic unmuted already. But situations like returning to work and dealing with health benefits are sources of anxiety as well for many survivors. Can you talk about your journey when it comes to employment and dealing with finances post-treatment?
So right now I am on disability, but I think during my cancer journey, because I was an immigrant and I moved to Canada and I joined a works place where I did got my medical insurance through my employer, which really helped me during my treatment and post-treatment. And I mean, financially, we were really stressed and still are, but because my husband lost his job during COVID, and that time I was going through stem cell, and I was in Edmonton and I had to move to Calgary for my stem cell transplant for 3 months. So at that time, social workers of Alberta Cancer Foundation really helped us in, providing some kind of funds for the medicines and stuff and a little bit. But my insurance was really nice. So I used to, whatever medications I used to buy was 80% covered, and then 20% I had to pay. But there was time that I used to get, I forgot the name of the injection, but I used to get that injection every week, and that costed me $2,000. And after insurance, it came down to $800. So that injection was like every week I used to get after stem cell. So we actually really asked our family from India to help us and support us, because we were really, in financial struggle that time. And it's not easy for cancer patients, going through those things like, going through treatment and then worrying about your financial status and stuff, and then going back to work. So I don't know. I want to go back, but I get that feeling. I don't know if I'll be able to give my 100% to the work, because the kind of work I was doing before was totally different. And there are good days and bad days. I get tired and 3 to 4 hours doing household stuff. And then I need a nap. I really feel tired after 4 hours of doing some house chores thing. Plus, I did lost my right eye vision during my cancer treatment. So, and then I was into early menopause. So I am on systematic hormone therapy, which actually, again, gave me a lot of fatigueness and tiredness every day. So every day is a different day for me. So I still struggle if I want to go back to work full-time or part-time. And how will it look like? Will I be able to go back to the same company, or I have to look for another, kind of a job, which is okay for me to do? So yeah, all these questions really hinder the mind a lot to cancer patients, and this can be a financial burden sometimes.
Absolutely. And these are struggles that every cancer patient has to go through. So thank you for sharing that with us.
Yeah.
Seba, perhaps I can move over to you, and if you could give us some suggestions and programs that are available federally or provincially to help patients that are unemployed, or what other financial supports are available to patients in remission.
Yeah, and I think this depends more so on where you live, right? And there are federal programs like employment insurance, sickness benefits, things like that. But provincially, I'm in Ontario, and there's Ontario Works and Ontario Disability Program, just to name a few. But I think it also sort of depends on your status in the country, your financial resources, and geographically where you live, right? And an organization like the Canadian Cancer Society is Canada-wide, and they have navigators to support you to walk through the eligibility requirements and the application forms for that. So that would be an important sort of resource to take. Like, as Harjeet mentioned, it's not easy, right? Going through cancer, but also post-treatment, because many things change.
Absolutely. Thank you so much for that, Seba. Dr. Savage, I think I might put the last question to you. We have just over a minute left, but as there continues to be an emphasis on multidisciplinary care for cancer patients post-treatment, how do you think survivorship care would look like for patients in the future? Or how would you like to see it, or how do you envision it?
Yeah, I mean, if we had abundant resources, I mean, I would love to be able to have some parallel survivorship clinic, actually, with attached to BC Cancer, for example. I'm happy that we have more nurse practitioners coming into the field in Canada, because that's been a lot slower than the US. And that's I think, a great model for survivorship and taking on that primary care role and having that expertise in particularly cancer survivors as well as other primary care, but still kind of jointly connected to the cancer center. I think there is a value of that if we were able to. At BC Cancer, there is a pediatric survivorship clinic, but it's not available beyond the pediatrics group, but I think it's relevant beyond that. So, but just like other places, it's all resources, space, and bodies, but we have to think about what the vision is to the future and just move towards it. So I hope
absolutely. If there's no vision, we don't work towards it. So, fingers crossed, this is actually what our reality looks like here in Canada. And so I'm very hopeful for that as well. I think there's so much benefits when we do have such an integrated, team in place for patients. And that brings us to the end of our time together on this panel. I'm so grateful to our incredible panelists. Harjeet, thank you so much for sharing all of your wisdom with us. Thank you so much, Courtney, Zeba, Dr. Savage, for sharing all that incredible expertise with our audience today. And also a huge thanks to all of you who joined us today at this session. As a reminder to all the attendees, the next session begins promptly at 5 p.m. So you have 1 more minute left, but we're actually going to be building on this discussion. So if you enjoyed this session, please make sure you actually join us with the next session. And thank you everyone for being here today, and have a lovely rest of the day.